So I think first and foremost, just looking at some of the data points, the adoption rate and what we actually partnered and contracted with October Health was 50%, but we actually landed on over 60% in terms of adoption, which was really good. Just looking at some of the engagements, that took place during the year as well, we landed on over 6,000, which was again a really good number. I think also just in terms of the feedback that we received from line managers as well as our people, it was overwhelmingly positive in that they were so grateful for and appreciative for the support that we had provided to them. And I think lastly, it's just around the data analytics. So if we look at just the insights that we receive on the line manager dashboard, it really assisted the line leaders as well as the human capital business partners just to drive strategic data-driven decisions and that informed their people plans. So what we did see first and foremost was at Old Mutual Insure, we do have a pulse survey that we conduct on an annual basis. And what was really great to see was that our employee engagement, specifically in the IWYZE space, increased by more than 8%, almost 9%, which was really good, especially considering that this was a space where the prior 3 years, we had actually seen a decrease year on year in terms of employee engagement. So I think first and foremost, that was great. I think secondly is just around, again, that verbatim feedback that we were receiving from our people. We had one of our employees share with us how Luna had actually helped him with getting a promotion. So I think it's in those moments where you really feel like you're doing something right. So it is early days since we scaled up to the rest of the cluster, and we embarked on this journey with IWYZE at the beginning of 2025. So what we have seen already is some great adoption rates coming through, and again, it's that verbatim feedback. So we're getting our people saying firsthand how grateful they are, how appreciative they are for this support that they're receiving. And just to share, we even had one of our colleagues in our team that actually lost her sibling. So it was a very traumatic, it was very sudden. She was really struggling. And so the feedback from the team was, try using October Health. And since she started using Luna and chatting to Luna on a daily basis, it's really helped her just with getting sleep, just with dealing with the trauma. So again, it's just receiving this very first-hand feedback from colleagues that's very reassuring. From a leadership perspective, we can see how the October Health app has assisted us just from data analytics that we are receiving that really supports line managers in driving strategic data-driven decisions. We can see also how the Thrive meter is really going to assist our frontline staff, just engaging their sense of burnout risk, flight risk, and just with the overall net promoter score for the frontline teams. And from a pulse perspective. So we have pulse surveys that we run, and we're really hoping that October Health will assist us just in terms of getting those pulse plans and engagement plans in place that's going to provide traction for our HC strategy. So the launch, pre-launch, post-launch, all of it has just been absolutely amazing with the team. I think it's a great team to work with. They are it's never a case of, can't do. It's always solutioning with us, collaborating with us, partnering with us, just in terms of driving and really getting those adoption rates going. And beyond that, it's how do we continue utilizing and ensuring that there's sustainable utilization of the app. So, our experience with the team has been amazing, and really looking forward to continuing partnering with them. The human capital strategy at Old Mutual Insure is based on 3 strategic focus areas, which is learn, grow, thrive. And so all of our HC initiatives aligns with these focus areas. And you can see how October Health, and just from their resources and tools that they provide, actually aligns very nicely with these strategic focus areas. Also from an EVP perspective. So our EVP is based on empowering our people to thrive, and just the ability to offer them this kind of support really speaks to us showing that we care for our people and that we are invested in their overall well-being. At Old Mutual Insure, we are all about the moments that matter in our clients' lives. It's what we live by, it's how we deal with our clients on a daily basis. And by way of an extension of this, it's what can we provide to our people in the moments that matter to them. So we can see how just providing a resource like October Health is really going to help our people in the moments that matter to them. And again, just from an EVP perspective, so our EVP is empowering our people to thrive. It's based on 6 pillars. If I list just 3 of the pillars, transformational leadership, customer centricity, high performance, again, it aligns, the October Health app aligns very nicely with our EVP pillars and just embedding our pillars further into business. Sure, there's a few things, actually quite a few things that I'm excited about with the app. I think first and foremost, it's just that ability to provide proactive wellness support to our people. And secondly, it's the data insights that we are going to be receiving from October Health. I think these data insights are going to be critical just in terms of informing our people, our strategic people decisions. And lastly, it's just working with the October Health team. The team is amazing. They are always willing to partner, to collaborate and solution with us in driving our key people initiatives in the business. There's a few. I think first and foremost, it's we are continuously looking at ways to embed our EVP into business, and be it both from an internal or an external perspective. And so we're really looking forward to partnering with October Health just to look at how we can further embed our EVP into business. I think secondly, it's just from a customer experience perspective and just looking at the customer care campaign that we launched in IWYZE and just looking at scaling that up to the rest of OMI and our frontline staff. That's going to be great. And then lastly, just in terms of our Pulse survey. So we do have a survey that we run annually, which does speak to employee engagement. And so we can really see how October Health is going to really assist us with the plans that comes off on the back of the survey. So we see October Health as our proactive wellness partner that's really going to provide our people with that support in the moments where they are dealt with stress, with crisis. But more than that, it's looking at how people want to really level up their performance in 2026. So for those people that want to focus on resiliency, that want to focus on a growth mindset, and just to improve their overall mental fitness, we can see how October Health is going to be able to provide that support. And not only just from a work perspective. So we really look at October Health just to provide overall well-being support to people integrating their work and their life. So we launched October Health this month, so it is early days, but we can already see great traction coming through in terms of the adoption rates, in terms of the sort of verbatim feedback that we're receiving from line leaders as well as employees. And what has been phenomenal is just looking at the clinically effective engagement rates, which is almost 6,000, and that's just in 1 month. So just looking at these data points, we can see we are on track to a very successful launch at OMI. We can see how the app has also really supported line leaders just in terms of improving their performance. You know, one of our EVP pillars is high performance, and so we really try and drive that in terms of our EVP at OMI. And this sort of enables our leaders just to focus on productivity. So how do they level up their performance? How do they get their teams to level up their performance? So we can see the sort of ripple effect taking place across the organization, which is great.